From the very many celebrities and athletes that market on behalf of this company, Smile Direct Club, I think it's safe to say very few people have yet to know what this company is all about. So in this video, we'll be going over what Smile Direct promises its clients, if it's safe, and if it's for everyone. So let's find out in this reaction video. Hello everyone, and welcome back to another One Mission DMD video. If you're new here, my name is Teham, and I'm a third-year dental student aiming to make your journey in and out of school a success while learning a thing or two along the way. Timestamps are going to be right over here, so feel free to scroll along through any part of this video. Let's get into it.
And we're recording. Perfect. And Cam.
Meet Andrew, Brittany, Amani, and Chip. 4 people in search of a better smile.
Okay, this one's filming. Okay, so put that in the pocket.
They work for us.
I have had crowded teeth since I was about 21.
Well, I've never had straight teeth.
I have this gap tooth right here. I think it's a little childish.
There are gaps in between my teeth.
Hi. Good, how are you?
They're heading in to check out Smile Direct Club.
It's nice and fast, so it could be already done by before summer.
It sells plastic aligners for teeth straightening.
We're very quick, we're very discreet, and we fit into your lifestyle so well because you don't ever have to come in.
Just pop into their Smile shop, get your teeth scanned, or buy their kit online and send in molds of your teeth.
Your aligners will be custom made for you.
Then wait for the plastic aligners to land in your mailbox.
So we're going to open this up for a lifetime supply of confidence, because that's what it is, confidence in a box.
If you can't afford to pay thousands of dollars for braces, then Smile Direct Club is definitely for you.
Okay, so to start off, it sounds very promising. It makes it seem like it's going to be cheaper. It makes it seem like it's going to take less office visits. Let's continue watching.
But seems not everyone is smiling.
I did not clean them.
Like Michael Johnson in Dallas, he now carries his teeth in a bag, thanks, he says, to Smile Direct.
These are the very first ones you would have put in.
That's the very first one I put in. Fits down there in the bottom of my teeth. That's it.
That's it.
That's it.
His treatment starts off well.
The first 4 to 5 months, I was happy because the teeth straightened out that had been crooked. Like, okay, this is gonna be pretty good, you know.
But after about 6 months,
that's when the tooth broke. I mean, I know that's when the loosening
tooth broke.
My tooth broke.
What were you thinking at that moment?
At that point, I put it back in and it hurt really bad. I was like, no, this hurt my teeth. I said, I'm stopping right now. So I stopped.
But his teeth didn't stop breaking.
So if I'm looking in your mouth, where have you lost teeth? Oh yeah, there.
That's crazy,
There.
man.
How do you feel? How do you feel?
Quite frankly, I feel like I just made a bad judgment call, or I've chosen something without investigating a little bit further, which is why I'm doing this. It may be good for some people. It was a bad experience for me.
So the fact that this is happening means that Smile Direct doesn't seem to have some type of like a check system to just evaluate the patient. So let's see what their process is for getting patients accepted into their programs before they're even sending out any trays.
Back on hidden camera,
You know, for people mild to moderate issues with crowding and gaps and spacing, this is an amazing alternative.
We do photos, a scan, a pre-authorization, and then we send everything off to the doctor.
is it that easy?
Are they going to tell me today if I'm eligible for this? Like, do you know, like, my chances?
We can't formally diagnose you with the doctor.
100%, yeah, no, that's good.
However, to bring you a little comfort, I see cases worse than.
Okay, so it seems like they have a scan and they're taking pictures and they're sending all of this information to a doctor. So a dentist or an orthodontist. So that's cool. I didn't know that. So I just learned that from this, that it seems like there's some type of an approval process that has to be made from a doctor at the end of the day. So let's find out if that's true.
Yours every day.
Oh, really? Right. Right.
Deal with mild to moderate.
I feel like a British cliche with this going on.
How many people are usually qualified for this?
We are 97%. We have a 96% approval rate.
Okay, that is very shocking because in the field of orthodontistry, we know that, just from my preliminary knowledge from what I've learned in dental school, not everyone is a good candidate for clear plastic aligners with like Invisalign or something like that, because it's just very specific patients that are eligible for that type of orthodontic treatment. A lot of others required additional things or things that are totally different to be able to get the results that the patient wants. So those numbers are shocking because that's not how it works with orthodontistry. Not everyone is supposed to be a good candidate for clear plastic aligners. Let's keep watching.
Orthodontics professor Dr. Hera Kim Berman has a problem with that approval rate.
Orthodontic treatment, period, is not for everybody. I think there's great potential for wrong and harm to be done for people who are not really informed.
She runs the oldest graduate orthodontics program in the world at the University of Michigan.
And would plastic aligners work for everybody in every case?
Not in every case. It has to be selective cases.
In your experience, is it the majority of cases?
It is actually special cases, minority of the
Exactly.
cases.
Will I ever have to see the doctor or dentist? or?
No, so we are remote teledentistry. We're the first company in the world.
Okay, another red flag here. The person is asking, the client is asking, do I have to see a doctor before to do this? They said no, but we are the first to do teledentistry. So they literally just said that you can get dental services without seeing the dentist. Teledentistry doesn't mean that you're getting dental evaluations or treatment through anybody else besides a dentist. It just means that you could be getting your teeth evaluated by a dentist or someone virtually, but that makes no sense. Those are two contradicting things. You can't do teledentistry without dental providers. So that's a fact.
To do this.
No dental exam, no orthodontist.
I've been certified iTero technician.
I'm a dental hygienist.
Sales staff use a smile stretcher and take photos to send to doctors off-site.
Goodness me. I can already tell I'm not going to look cool with this thing.
Say Smile Direct Club. Smile Direct Club.
Next up, a high-tech scan.
Nice big open.
6,000 pics a second with that wand.
Whoa. Look at that mess.
Well, that's why you're here, right?
The scans are used to make a treatment plan.
This is what you have currently, and this is what the simulator shows. This isn't 100% accurate, obviously.
And a doctor registered in your province decides whether to tweak and approve it or not.
Would you be comfortable treating someone in this way?
With photos and with just a scan, I would be very uncomfortable and hesitant. I would insist on seeing the patient first. We have to find out their health history and do a complete examination to make sure which teeth have crowns, which teeth have implants.
Well, the testers do get asked that, sort of.
This one is your dental history questionnaire. So
Okay, so they're being asked something, so that's good.
No.
These are the dental questions. They're currently defaulted to no.
Loosening of any teeth? No. Allergies? No. Don't know what any of those other ones are, so I'm going to say no.
usually is no.
Cool.
It's good. We like no's in this case.
We like no's in this place.
Yeah. So, first of all, our questionnaires and health history should never have a pre-selection. It's always
Absolutely.
empty. And there should be some clarification if somebody says, I don't know what these are. Not just, we just like no's.
What does bridge work?
You'd know if you had it, so don't worry about it.
I actually haven't had health insurance for like 4 years, so I haven't been to the dentist in a minute.
Okay, that's fine.
So I have no idea.
Just put no, that's fine.
The customer is actually asking for information, and they're not getting it.
Right.
What is IV bis?
Don't worry, say
Okay.
no. Say no and move on.
IV bisphosphonates. Oh my gosh. She quickly dismissed IV bisphosphonates. Oh my goodness. So patients are taking those that have like osteoporosis and bone loss. And there's a bunch of contraindications with so many procedures, specifically extractions with patients, because it can affect just the prognosis of the patient if the tooth is coming out in an area that isn't as strong with bone. And if they're taking these type of medications, that's alarming. That's a huge red flag right there.
I don't think I have an implant.
I'm sure you don't.
And I haven't had a bone marrow transplant.
Okay, so
Okay, she's saying, I'm sure you don't. And all they did was take a scan. You can't tell by just taking a scan, especially if you don't have a dental background, if a patient has implants. You can't, typically, if someone doesn't have a dental background, you can't tell if a person has a bridge if they're smiling or you taking a picture of it. Like, all of these things are determined through x-rays. We can see which tooth has a crown, which tooth has a filling, which tooth is not there, like how much bone there still is in their mouth, if they have an implant. All of these things are assessed through radiographic diagnosis, and none of that's happening here. And the people are dismissing these patients' questions regarding all of that stuff. Huge red flag.
All good.
Knock on wood.
Yeah. Transplant. Yeah. Well, okay. Well, they just need to know.
So she's very dismissive. It seems to be just a cursory thing that they kind of have to do to get to that scan.
Back in Dallas, Michael Johnson says he warned Smile Direct about his teeth issues.
I knew I had a dark spot on the teeth back in the back to fill out. I said, I don't know if I'm going to qualify. She said, you'll be fine. You know, she was very reassuring.
He's approved. Months later, when his teeth crack, Smile Direct tells him the aligners do not usually cause teeth to break. They review their records and say some teeth had possible decay and a fracture line.
If they found this, I should have been disqualified.
But Smile Direct tells him, you signed a release stating you had had a dental exam. These areas of concern should have been addressed with your local dental provider. What do our testers hear about visiting a dentist?
Should I be seeing a dentist before I do this?
If you feel something like it's in pain, like maybe your teeth is erupting or something like that, then I would recommend to see them beforehand. But if you don't have anything that alerts you, then you should be fine.
But that's...
Okay, so what the person at the Smile Direct Club office is saying is not what they have written in their bylaws and their contracts that patients are signing. So they definitely have covered their tracks. They've been pretty smart, and they told the guy that lost his tooth, unfortunately, hey, you signed these papers, you said you'd get a dental exam done, you said you'd get checked for all these things before all of this stuff happened. So patients are signing things not knowing what they're signing, and they're being told something different from what the providers and the people at these offices are telling patients. So huge red flag. There's some inconsistencies, and this is not good. This is definitely not good.
Not what Smile Direct's consent form says. It's your responsibility to see a dentist within 6 months prior to starting Smile Direct Club aligners.
Okay, so there's no need for just a regular checkup.
The scan can actually capture a lot.
Okay.
Oh my gosh. Okay. So whoever wrote these contracts and the higher ups of the company, they have covered their tracks. They definitely made sure to get all this stuff written down so that they don't get into legal trouble. This person just said, you don't need a dental checkup because the scan is going to pick up everything. A scan is not going to pick up periodontal disease. A scan is not going to pick up gingivitis. A scan is not going to pick up the implant work, the crown work, the bridge work. If the patient's taking IV bisphosphonates, if the patient's on Eliquis, if the patient has any type of concerns that need to be addressed before getting this treatment. Huge red flags right now. Huge red flags.
Capture a lot.
Okay.
The scan cannot pick up those things like gum disease and periodontal disease, implants, and so forth.
But a dentist and x-rays can. And the consent form says you're certifying your regular dentist checked for those issues.
Oh my gosh. So they're not only saying that you went to the dentist, but they took x-rays, they did a full exam, they did the whole 9 yards. They definitely were smart. Whoever's running this company, they know what they're doing, and they are covering their tracks.
On Hidden Camera, our consultations are almost over.
Did you read anything about the pricing?
I think I want to have a think about it, if that's okay.
The payment comes out when the orthodontist actually approves your smile, and the aligners will be in production.
Okay, I can't decide afterwards to pay?
So you can, but it's just because there is a waiting line.
Okay.
So we just don't want... Yeah.
You hold your place.
Yeah.
You lose your place if you don't pay up.
They're threatening the patient that if you don't pay right now, even though you haven't been approved for anything, we don't know if you're a good candidate for this treatment, you have to pay now because you'll lose your spot. That's not good, man. It's not looking too good for Smile Direct Club right now.
So if you look at him now, you can see that his bite is really good.
She says this plan would close his gap, but it'll also pull back his upper teeth so that they hit his lower ones.
Does it make things worse?
It makes things worse, yes.
But if you're looking for a cheaper solution, is this okay?
It's not okay, and the bite is going to be either traumatic or he's not going to have a correct bite.
We asked 2 other orthodontists to review Andrew's plan. Both say it could work, but all of them say it's tough to tell the health of teeth and gums just from a scan. Time to dig into Brittany and Imani's plans. First red flag for the doctor, both scans miss some of their teeth.
So when the aligner doesn't fit well, this is the reason the scanning was not good.
And that's not all. She says Brittany's proposed treatment pushes out her crowded upper teeth, potentially causing problems with eating and speaking.
This is not acceptable because she will now have a lisp, which she will be very cognizant of.
Meanwhile, Imani's top teeth would be pulled inwards.
So if you look, they're bringing everything back, but they can't close all the space.
Oh, I see.
Because now you're hitting the lower and
Oh my goodness, man. Okay. A scan is a good way to get a representation of a patient's oral cavity. But if it's not done properly, then the treatment obviously won't be done properly either. The teeth in the back are the ones in this picture that weren't captured properly. So that means that they have decided to move on with this treatment plan, move the teeth that need to be moved, and then we're not able to predict properly what the movement of that tooth that wasn't captured properly will look like after the treatment. So you're kind of taking a chance. So that is definitely not what we'd want for the patient.
Smile Direct tells Chip his teeth aren't that bad.
I see cases worse than yours every day.
But this orthodontist sees something much more serious.
his diagnosis is a severe malocclusion that is class 3 with a negative overjet, underbite, and severe crowding. It is not appropriate, and this...
None of those things are addressed or even probably an issue of concern for Smile Direct Club. These are very serious things and need to be evaluated very in-depth by the orthodontic treatment, whoever's getting any. And it looks like he's just getting his accepted treatment plan with his trays ready to go, sent to home, without even these things being addressed. And the patient themselves might not even know what these things are until it's too late, like that other guy in the beginning.
Patient should be not approved.
She says his underbite will get worse, and his bottom teeth are being pushed out so far, they risk falling out.
So out of the 4 people that went in, 3 of them have been evaluated to not be good candidates for this type of treatment because of the risks involved. That's a 75% non-acceptance rate when they're accepting more than 90% of all the people that come in through those doors. So that is definitely alarming.
Thanks for calling Smile Direct Club. A Smile expert will be with you shortly.
On customers' consent forms, it says you've had a chance to talk to the doctor who approved your plan. That's what our testers are trying to do.
Thanks for calling Smile Direct Club. How can I make you smile today?
I'm just looking to speak with the dentist that approved my plan.
Because I have some more questions.
The doctor that approved your Smile plan?
Yes, please.
I don't have a way to connect you directly to a treating doctor.
Is he just, or he or she, unavailable today? Is there a chance of doing that in the future?
Unfortunately, there is no way to connect directly to the treating doctor.
Smile Direct now says this isn't ideal. Says there will be a dedicated email and phone number so you can reach your treating doctor.
Currently, 13 minutes that we've been waiting.
Our testers?
Another inconsistency with what the bylaws and the contracts are saying compared to whatever the people that are working at these facilities are telling the clients and patients. Definitely not good.
The doctor directly, I'll have to set up a time for him to give you a call.
And a week later, he makes contact.
I have some more questions about my Smile plan.
I would 100% suggest that you go for a regular checkup, just because you never know if there's something happening.
He also says Andrew should consider other options.
I would say a sustainable alternative compared against this. I think you'll find comfort in one of them, you know, especially after you understand the risks and the pros and the cons.
Advice our testers never heard in the smile shops.
A lot of problems here, a lot of things that have been brought. At the end of the day, is Smile Direct Club a safe option for everyone? The answer is absolutely no. It is not safe for everyone, and it is not made for everyone. No matter what these companies want to tell you, no matter what their advertising and marketing techniques and tactics are, it is not meant for everyone. And it doesn't seem like they're advertising that from the beginning. Yes, it seems like this can work for some people, very select people, but you're taking a chance, you're taking a gamble, because they want you and are expecting you and have written in their bylaws and contracts that you will go get checked out by a dentist. And they won't check in with you and ask you if you've done that. They won't ask for proof. They won't ask for any x-rays or anything like that. They're not gonna check for any type of dental problems or conditions that can be going on in your mouth. Like the orthodontist at the University of Michigan was stating, you can't evaluate overall dental health by just taking a scan and photos. You can't. Can it be done for some people? Yeah, it could. And out of the 4 people, some dentists said, yeah, it could work for that one person, but majority of them said no for the other 3. Everyone has things that need to be addressed, and that's why going to your dentist is very important. And if you are looking to get treatment from Smile Direct Club, at least do yourself a favor and go to the dentist first and get checked to make sure you don't have any type of things that can be of concern with treatment going on with Smile Direct Club. You don't want to be like that person who lost their tooth because they weren't supposed to get the treatment in the first place. Anyways, I learned a lot from this video. I learned what Smile Direct Club does, what they aim to do, and what they expect their clients to do. Anyways, I hope you enjoyed this one. I'll catch you guys in the next one. Peace.